What is varicose veins? The importance of diagnosis and treatment. Varicose veins are a common issue for many people, which can arise from low-risk causes like prolonged standing or more serious conditions like cancer. In this video, we will explore what varicose veins are, and after examining their causes, symptoms, and diagnosis, we will discuss the various treatment options for varicose veins. What are varicose veins? Before discussing the causes and treatments for varicose veins, it is essential to understand what varicose veins are. Varicose veins are enlarged and painful veins that are most commonly seen on the surface of the skin on the legs and thighs. This condition is prevalent in the general population, affecting about 25% or 1/4 of individuals, with a higher prevalence in women. In the United States, nearly 40% of people suffer from chronic vein inefficiencies such as varicose veins. What causes varicose veins? In the structure of the large veins in our bodies, there are valves known as leaflet valves that act unidirectionally, allowing blood to flow only towards the heart. Along with these valves, the muscles in the calf and thigh press against the walls of these veins through their contractions, enhancing blood flow towards the heart. Additionally, the pulsation of arteries adjacent to the veins also contributes to the upward movement of blood towards the heart. This is why you might feel heaviness and fullness in your legs after a long walk or standing for several hours. If for various reasons, such as prolonged standing, family history, age, obesity, pregnancy, menopause, or the presence of a blood clot in the veins of the legs, the natural flow of blood upward is disrupted. Blood accumulates in the veins and exerts pressure on the vein walls. This pressure causes the edges of the leaflet valves to separate from each other. This leads to the vein changing from a tube-like shape to a large pouch, making the vein inefficient in transporting blood. Structural issues in the veins, genetics, and orthopedic or vascular surgeries on the legs are also significant risk factors for developing varicose veins in the future. Diagnosing varicose veins. Diagnosing varicose veins is not particularly difficult. In fact, diagnosis relies on the symptoms of varicose veins, and the presence of these symptoms in an individual confirms the diagnosis. It should be noted that varicose veins can occur in other parts of the body as well. However, due to the effect of gravity, they usually occur more frequently in the legs. The most important symptom of varicose veins is the appearance of twisted and misshapen veins, especially in the legs, which most likely indicate varicose veins. In addition to the appearance of the veins, pain, swelling, and redness around the prominent veins are also noticeable. Itching is a common symptom of varicose veins, caused by the leakage of hemoglobin from the blood and vein walls into the interstitial space around the cells. The importance of diagnosing varicose veins. The critical aspect of examining varicose veins is diagnosing and identifying the underlying cause of varicose veins. Various factors can be involved, ranging from less important to more serious and risky causes for an individual with varicose veins. The presence of malignancy or cancer can manifest as varicose veins in the legs. Additionally, one of the important causes of varicose veins is the presence of blood clots in the deep veins of the legs, which are potentially dangerous. The physician should initially take a history and examine the patient's lower extremities, both while lying down and standing up, and then proceed with an ultrasound or venography of the leg veins. A type of ultrasound called Doppler ultrasound is a suitable, cost-effective, and non-invasive method for assessing blood flow in the deep veins. If there is a clot causing an obstruction in the blood flow in the vein, the doctor will be able to diagnose it and take appropriate treatment measures such as prescribing anticoagulant medications for the patient. In venography, a dye is injected into the bloodstream, and imaging is done using X-rays. Treatment of varicose veins. Usually, the first preference and choice of doctors when dealing with varicose veins is conservative treatment, as surgery and invasive intervention, despite their benefits, also have significant disadvantages, and there is always the possibility of varicose veins recurring. The first recommendation for patients with varicose veins is to change their lifestyle and dietary habits. Quitting smoking, controlling obesity, regular exercise, and avoiding prolonged standing can yield beneficial results. Below are the main treatment methods for varicose veins. Compression stockings. Along with the aforementioned measures, patients are usually advised to use elastic and compressive varicose stockings. Applying pressure on the inefficient veins acts like a muscle contraction, helping blood flow towards the heart and being very beneficial in treating varicose veins. Varicose stockings should be worn even at night while sleeping for better results. Choosing the right varicose stockings in terms of comfort and effectiveness is crucial. To select the appropriate stockings, the legs should be measured in the morning upon waking up and before getting out of bed. For calf-high stockings, the knee should be bent at a 90-degree angle with the foot flat on the ground, and the length of the calf, the thinnest part, and the thickest part of the calf should be measured. Besides the appropriate size of the varicose stockings, their firmness and elasticity degree are also important and should be chosen with the doctor's advice. Surgical treatment and modern methods. Surgical intervention is considered when previous methods, like lifestyle changes or using varicose stockings, have not been effective enough or when cosmetic concerns are of high importance to the patient. However, surgical methods to eliminate varicose veins are not commonly performed due to the availability of newer and less invasive methods. In varicose vein surgery, after anesthesia, the segment of the vein that has lost its normal shape is cut and removed. Several newer treatment methods have been proposed in recent years for treating varicose veins, including sclerotherapy. In this method, after injecting medication into the large veins, the vein is blocked and removed from the blood circulation route. Microsclerotherapy, similar to sclerotherapy but used for smaller veins. Endovenous ablation therapy. This method uses heat and electromagnetic waves to block the varicose vein. Thank you for watching. If you found this video helpful, please subscribe to our channel and like the video.